a little bit from going through your findings, and I first want you to help us understand CRPS as you know it. Have you treated CRPS patients?
Oh, yes, I have a lot.
Can you give the jury an idea of how many per year?
I actually did that calculation for this, yes. So approximately 5 patients a week for 20 years, and the math came out to be about 125,000 patients in the last 20 years with CRPS.
My goodness. And have you yourself participated in any studies or surveys?
No, I haven't. You mean done research on it?
Yeah, or cooperated in providing patients for clinical evaluation, things like that.
No, I don't want to. I don't like to send my patients for clinical. They're already in so much pain and they're already suffering, and I don't do that.
Understood. So tell us now the signs and symptoms of CRPS that they can understand as we go through this and show photos that they should look for here.
So CRPS is one of the few pain conditions that you can literally see. I mean, if I say I have a headache, you can't see the headache. If I say I have knee pain, you can't see that. But CRPS is one of the conditions you can actually see. And the diagnosis of CRPS is based on very clear rules and regulations. There's a whole checkbox, and you have to check certain boxes. And when you check a certain number of boxes, then you come to the conclusion that the patient has CRPS. So, for example,
no, please. I'm asking you to go through. It was okay.
Right. For example, obviously the first one is that the patient has severe excruciating pain, and there is no other explanation to it. Nothing else explains it. That's the number one. Number two, the rest are kind of optional, and you have to pick and choose which ones you see. So one of them is there a temperature difference? So if I have CRPS in the left leg, and so the temperature in my left leg might be hotter or colder as compared to the right leg. The next thing is you look at color change. Oftentimes the affected side is either dark red in color, even blue in color as compared to the right side. You look for swelling. In the initial phases, swelling is pretty obvious. Later on, you don't see it as much. So you look for swelling in these patients. You look for skin changes. The skin may sometimes become thin and shiny, or they may develop small, tiny lesions, almost like blisters that are painful. They can develop that. They even develop hair changes. Some patients actually grow more hair, and some patients have less hair. It can be in the same side or on the opposite side. You can see nail changes. Their nails start to kind of break off. They get brittle nails.
What about asymmetry in muscle groups from right to left? Is that an indication?
I was getting to that.
Sorry.
So the last one is muscle symptoms. So do they have what's called dystonia? Dystonia is a terrible condition. So I'm going to show you. Like, if I had dystonia in my left hand, it would be like a tight muscle, like the arm is taking a life of its own and it's cramping up. Or they may have tremor. So they may not have tremor when you don't do anything, but if you say touch them and then they start to have a tremor, they may have muscle weakness, they have muscle atrophy, the muscle starts to shrink. So there are many muscle symptoms that these patients can have.
I want to, if you could, and I think I wanted you to explain what really happens in CRPS, the central. I want you to explain what we know so far about CRPS, how it starts. Yes.
I just have one other clarification on CRPS. When I say that these patients have pain, we're talking about the world's worst pain. I mean, this pain is worse than amputation pain. This pain is worse than childbirth pain. The gentlemen on the jury won't understand that, I'm sure. This pain is so bad. The worst part about this pain is that, if I stub my toe, it looks like the world is going to come to an end, okay? But I know that this is going to go away in a few minutes. But CRPS pain does not go away. It's there 24 hours, 7 days of the week, and it just stays on and on and on. And the worst part is that there's no known treatment to this. We try all sorts of things. Some work, some don't work. But this is often known as a suicide condition, because these patients, the pain is so bad They can't sleep, they can't eat, they can't work. Their families don't believe them because, you don't think like somebody. The general impression is, oh, you have pain, take a Tylenol and it'll get better. This is not Tylenol pain. This is your hand in a hot stove. That's exactly what they described as. In fact, patients describe it as if their hand is inside a hot fire stove, and and they can't take it out. That's the thing. So I just want to clarify that this is, when I say pain, it's not a small itty bitty pain in the joints.
And what is the McGill pain scale?
The McGill University in Canada decided to see, like, okay, where do pain conditions stand? So they interviewed a bunch of people and they said, all right, where in this scale would you put your pain? Like pain from labor or pain from amputation of a digit. And so they drew a scale, and that scale, CRPS was CRPS was way above anybody else. It was way above amputation pain, cancer pain, or even labor pain.
With your permission, Your Honor, I'd like to publish a photo of the McGill pain scale. Can you bring it up? The jury can see. Ta-da!
So
Miracles of technology.
what I'm seeing is what the jury's seeing.
Yeah, the jury sees that.
Okay, so if you go from the bottom, you can see tension, headache, sprain, and so on. As you go up, then you see non-terminal cancer, chronic back pain, and as you keep going up, prepared childbirth is number 32, and then you keep going up, and then you come to amputation of a digit is 39, and then so forth, and then finally CRPS, often it was originally known as RSD, is rated as 46. So on a scale of 50, 0 to 50, CRPS is 46. Nothing is higher than that. It's such a terrible pain.
Now with this, can you tell us from your experience whether any of your patients have had, not parents, patients, but any of your patients have had difficulties going through a number of doctors before they're diagnosed?
Yes. So unfortunately, most doctors don't know about CRPS.